Is it a neck problem or is it a shoulder problem? There's a big difference in figuring that out. Check this video out. What's up, everybody? My name is Dr. Matt Maggio, and I'm the founder of the Soft Tissue Revolution and the creator of the Peak Method. And I'm on a mission to solve the pain pill epidemic and make chronic injuries obsolete. In today's video, I want to give you some education and trying to figure out if you have a shoulder problem or a neck problem. You know, we get clients and patients that come in all the time and they're like, my shoulder hurts all the time. And essentially what happens is they get the wrong diagnosis about what's going on. And if you don't know what the problem is, you can never fix it. So this area in through here is very common for the majority of any human that lives in modern society to get a lot of pain. And a lot of times that locates right in through here, right back through the back of the neck in there as well. Now, when it's truly a shoulder problem, a lot of times you're gonna have more of that pain out in the lateral part of the shoulder, and there's a big difference about what's going on. I've had clients in the past that they got diagnosed with a shoulder problem and they went in and did exploratory shoulder surgery, but they had a neck problem all along. And a lot of times what we end up finding too is that a shoulder problem is actually hiding a neck problem. When we get the shoulder moving in a much better place, then what happens is it exposes the neck. So there's a big difference, and I want you to be able to be equipped to know if you're having a shoulder or neck problem, because if you do not know what the problem is in the first place, you can never fix it. And so many people are getting treatments and diagnoses that don't even make sense, and they're not getting a resolution for their problem. So there's a really big difference, not just based off of where you feel the pain. So the big thing that I always start with, and when clients come in or patients come in, I ask them to point exactly where they feel the problem. And when people come in here and say, it hurts out here, I'm thinking more and more that that's a shoulder problem. Now, the next thing I do is ask some questions. So when you have a shoulder problem, there's some signs and some symptoms that are showing that. One is definitely some popping and clicking, especially with movement and everything like that. When you pop and click, you're actually putting some pressure on the joint in there as well. The other one that people will say is it kind of feels stuck. If you go to reach for something, like maybe put your seatbelt on or reach for something in the back seat or reach for something up in the cupboard, it feels kind of stuck. The other thing that people end up saying is that it's really sore, especially when they lay on it, it feels inflamed and sore. Another area that we look at is it's just hard to move, very labored with motion. When you're lifting your arm, it should be nice and easy. And a lot of times people feel like it just catches and doesn't do what it's supposed to. And mostly just worse with movement. A lot of times the shoulder doesn't hurt too bad unless you lie on it or you actually move it. So that's a big difference. Trying to decide if it's a shoulder or neck problem essentially is where you're having it and if you're having this type of pain. Now, getting into the neck. Like I said, you can basically go to any person out there in modern society and they'll be like, I got pain and tightness in there. And a lot of times people think it's a shoulder problem. I've been amazed at how many people come in and go, my shoulder hurts. And I'm like, no, it's not your shoulder, that's your neck. So when it's a neck problem, it has more of this kind of going on. One of those is tingling, it'll feel like numb and tingling in there. Another one is a lot of burning. Also some stabbing pain, especially when you go to move your neck around and do things like that. Another one is going to be throbbing. It just feels like it's on fire and it's going all the time. And the other one is constant. When it's a neck problem, it's always there. It's usually a little worse in the morning when you get up, and as you move around, it feels better. But by the end of the day, it feels bad again as well. So what I wanted you to get out of this video was the idea that you have to figure out exactly where that problem is coming from. Is it a neck or shoulder problem? Because it's going to alter the treatment and how you do things. And if you don't know what's wrong, you can't get the solutions that you need. So that's all I got for this video today. If you like this video, it helped you, drop a comment, give us a like, give us a share, or send us a message if you have any questions. We're always here to help. And the best thing you can do is you can share this video with someone else that you know can help. I'll see you guys on the next one. Bye.